I might be going back. Trying to get different words to like say urgency.
Yeah. I mean, I think that's becoming a lot more common given our and especially when there's more complicated degrees like others.
All right, welcome back, everyone.
I'll talk to you.
But
You want us to sit?
Yeah, you can go. I'm paying for my own.
oh, you think?
I don't have any trouble.
And I can't go unless
Well, I haven't gotten the invitation.
well, when you do, could you suggest?
It may have been a verbal.
Bring me along. Or,
Yeah.
and then I can go along if I can, because I want to go.
I think Peter Salam is supposed to be in town next week or the week after.
Hey, Peter, I'm Joe.
I'm not going to.
You here or where are you going?
All right, so I'm going to start the second panel by doing some brief introductions once again. And again, we have Mr. Dennis Carroll with a lovely picture. As you remember, he currently serves as the director of USAID's Emerging Threats Division. We also have Dr. Peter LaPuma. Dr. LaPuma is a professor here at Milken and teaches sustainability and environmental and occupational health, and researches life cycle assessment of the air pollutant and greenhouse gas emissions associated with various sustainable energy strategies. He also runs the EOH Department's practicum program here for the MPH students. Dr. Joseph Anelli is a former USDA Animal and Plant Health Inspection Service Veterinary Services Senior Advisor for Agriculture and Health System One Health Coordinator. Today, Dr. Anelli continues to advance the cause of One Health. Post-retirement, he has been consulting with the World Health Organization and is participating in the development of a zoonotic disease guide. And finally, we have Captain Sarah Newman, who serves as the Director of the National Park Service, Office of Public Health. In 2016, Dr. Newman was appointed by the NPS Director to serve as the Bureau Scientific Integrity Officer. Dr. Newman is an ex officio board member of the National Environmental Education Foundation and co-founded the Commission for Epidemiology Interest Group in 2002. So thank you all for being here today. Collaboration mechanisms work. So in the first panel, we talked about what stakeholders need to be brought to the table and who needs to be working together to make response, prevention of natural disasters possible through a One Health approach. But what type of mechanisms actually be effective? And anyone can answer, just at your own.
Left or right?
Not fair that you all came all look this way. Well, I guess. Can you hear me in the back?
Yeah.
Okay. So, I guess it depends on the disaster. I think that the sort of the blend of stakeholders probably is dependent on whether you're talking about a hurricane, a flood in the interior of a country, or a pandemic influenza outbreak. I know that with my military background, one of the things that I can toss in here is the need to train, the need for the players to train under different scenarios. One of the things that we used to do in the military was we would be on a disaster response team within our base. So we'd have a fuel spill, a mercury spill, something like that. And it was always a disaster if you did not know the players in advance. It was really helpful to have trained with the other agencies and organizations in advance so that you at least got to know the stakeholders, you got to know who had what equipment, who had expertise in a certain area to begin to draw upon. So that
since he's not here, I can misquote him. And he was commenting once during the tsunami in Asia in 2004. He came back and he was reflecting on the events there and the deaths that occurred. And he said that if we were all honest, when we put down the cause for death, it should have been lack of coordination. Right? That's the fundamental. Many of these deaths should have been averted. The inability to properly save these lives had to do with poor coordination. So the point that Katie made earlier is that coordination doesn't begin during the event. Coordination begins before, and we should spend 90% of our time preparing for and coordinating for an event that we spend 5% of our time responding to. So that's the first point I'd like to make. The second point that didn't come up in the previous discussion, I'd like to draw attention to it. When Anne, congratulations to her for being able to shine a light on the true mortality for the Maria hurricane in Puerto Rico. But what wasn't really highlighted is that the hurricane didn't kill those people. Only a handful of people died from the hurricane. It was the failure of critical services being sustained in a post-hurricane event. I have family who lived there, and they went 7 months without electricity. You know, people died because of lack of continuity of services. Hospitals were unable to provide critical services. People didn't have access to pharmaceuticals. They didn't have access to potable water. And, you know, when we talk about who has to sit at the table of coordination, it's not just the responders to an event. It's the resilience of society after the event, how well we come back and how well we ensure those critical services. When you go back to 1918, you know, the virus killed a relatively small percentage of the populations. It was secondary bacterial infection, and it was you know, the failure of health systems to be able to provide normative care. You go back to the West Africa epidemic, Ebola epidemic. There's not been the same insightful study that was done in Puerto Rico, but there's a lot of anecdotal evidence to suggest that during that epidemic, the collapse of health systems led to more deaths associated with women giving birth with the absence of trained birth attendants, failure for children to get access to vaccination, lots of measles outbreaks, people dying from malaria because they couldn't get essential health services, and those people who have chronic, you know, debilitating, life-threatening diseases not able to get life-saving interventions. The failure of systems to be able to be sustained during an event. You know, the cause, whether it's a hurricane or it's an infectious disease, they tend to be the least worst culprits. It's our failure to prepare for the large collateral consequences to these events. So when we talk about coordination, coordination has to take into account the event and the post-event. And our preparedness needs to think about a whole of society approach towards being able to prepare for and maintain critical life-saving services, whether it's electricity, or whether it's potable water, or whether it's food security, or if it has to do with health care. So how do we do that? How do we make you know, that coordination more sustainable and feasible? First, picking up on Katie's point, it happens before, not during. And we have to, again, there's this transformational culture that we have to go through, change, that we're not good at. We do not prepare for events until they happen. And it goes back to the short-sightedness that Ron spoke to about political leaders. Political leaders are not the only ones who are short-sighted. We as a community are headline-driven. And so we only respond to those things that are the proverbial kicking your door in and reacting to those doors flying in your face. We don't use our ability to predict and understand and forecast and use that insight that we've got. This is an era of big data. We have so much information that tells us what our risks and vulnerabilities are, and we don't harness it. And if we harnessed it, we would understand that the only way we're ever going to really mitigate the worst consequences of preventable events is by setting up an investment in sustained coordination before the event. So where we've seen the most successful examples of sustainable coordination, military is definitely the best example. Money's no object when it comes to military preparedness. So there's a page out of that book that we have to take, and one way or another, political leaders don't bat an eye in terms of investing in military preparedness. They walk out of the room when we talk about any other kind of preparedness, and we have to change that culture. Last point, private sector. We didn't talk about private sector earlier, but they are critical providers of core services. They are largely, in the United States, we're sitting proximal to not a public sector hospital, we're talking about a private sector hospital. We have an event in this country, it's not going to be the public sector that's going to be providing critical health services, it's going to be the private sector. It's not going to be the public sector that is providing electricity, right? It's going to be the private sector. We need to bring to that table private sector leadership, because one, they understand better than politicians or the general community their vulnerability. Their business model is built on risk mitigation. They want to understand what it is that is going to disrupt their services and undermine their profits. And they understand risk and invest in risk mitigation to a degree that the public sector shamefully is pitiful at. So getting the private sector around that table and maybe sort of doing some gene editing in our own public sector community to draw a little bit from the military and a little bit from the private sector and imbue our own sense of risk mitigation on the basis of risk identification and risk investment. So we don't invest in risk. And let me end with one final point. Benjamin Franklin, there's the old saw, Benjamin Franklin says an ounce of prevention is better than a pound of cure. I've always thought he was talking about health. He was not talking about health. He was part of the city council in Philadelphia, and he was talking about Philadelphia's absolute inability to prepare for predictable urban fires. And we didn't have building codes, we had no fire codes, we only responded to fires when there was a fire. And what Benjamin Franklin began shining the light on is that these fires were preventable. If we had proper building codes, which is exempt in this room, you wouldn't have the fires in Philadelphia. And so that ounce of prevention was building into the systems the foresight to require every building to have the kind of standards that minimize the risk of not only a fire starting, but spreading from one building to the next and the next. And so ounce of prevention is worth more than a pound of cure. It's not simply about health, it's about how we live in this society. We have to be able to invest in risk. And Benjamin Franklin was saying the risk of a fire requires that we invest in that risk. And we have whole insurance companies now that are predicated on insurance policies that are about risk mitigation.
I'm going to use both of those as a bit of a platform. Something that I always say is that we are a reactionary species, that we will not act, as Dennis has said, until there is some sort of disaster. So my challenge to you as the upcoming leaders in public health and One Health is to find that tipping point that's necessary to take it to that next step. I'm sure Benjamin Franklin, there was some fire in Philadelphia that had initiated that discussion. There was an issue with people not wanting to evacuate from a hurricane area because of their pets. And there were big arguments about people staying behind so there was somebody to take care of their pets, even in mandatory evacuation areas. But still, within what was then the federal response plan, now again, was not interdisciplinary, it was only federal response plan, there are multiple emergency support functions. Emergency support function 11 is for agriculture. But at the time, agriculture only meant food and nutrition service, providing what they ordinarily provide in the school lunch program, to be able to provide food after the hurricane to congregate feeding facilities. So wherever they had shelters set up for people. USDA's only responsibility was to deliver food to that particular location. So what did it take to make that change? What was the tipping point? September 11th, 2001. It took that terrorist act to force FEMA to look at the way they respond differently. So they rewrote what was the federal response plan into the national response plan. So now it included everything our other panel was talking about, you know, from national government down to local governments and municipalities working together in this same structure. And while that was getting rewritten, it gave us in USDA an opportunity to rewrite ESF 11, and that's when we included animals in disasters in the response plan. So that then, in terms of what kind of mechanisms work, it has now been officially accepted since about 2003 that there is also a component of the response plan that includes taking care of animals. Across the board, the Medical Reserve Corps started to, and that's something you guys should all sign up for complete disclosure. My daughter is a public health service officer. She works for the Medical Reserve Corps. Please sign up in your jurisdictions. But the Medical Reserve Corps also now has a veterinary corps component to it. Something we tried to get started in 2001. People wouldn't think of animals as part of this, you know, most folks, and hopefully you are coming to this club because you don't think of health beginning with human. You think of health from, you know, the sort of ground, literally, dirt, food producing, etc., on up. So they didn't want to put in a veterinary reserve corps at the time. Many years later, the Medical Reserve Corps, which was funded now and was out of the Surgeon General's office, had a veterinary reserve corps. So now, when people are called up to staff shelters for hurricanes, they also call up veterinarians to establish animal shelters so that people can be evacuated with their pets. In fact, I remember sitting at the FEMA headquarters during Hurricane Katrina, and I heard somebody from ESF 8, which is health and medical, saying, no, we have no place to put the dogs. And I'm like, yes, we do. You can, but we were starting that then, but it took September 11th to do it. However, the best mechanism to coordinate these multidisciplinary approaches is personal. I've worked with Dennis for 15 years, 18 years now, on various things. We have the kind of relationship that when we need to share information and so on, it's a simple phone call. You haven't heard yet, but I've worked with people in her office, never met her before, worked with people in her office for the last 10 years. Do we have a formal mechanism for coordinating? We've tried to form one. We created an interagency One Health working group so that we would have monthly calls or you know, occasional calls at least to bring us together and have common discussions. But those won't happen if we didn't have the personal relationships as well. So for now, I'll leave it at that. There are ways of making sort of formal things, like we've actually put it in the National Response Plan, but the thing that still makes that work is that you have the personal connections with people so that you think about And it goes into that exercise thing. You have to know somebody ahead of the disaster in order to work well with them, even if you're working within a common system like the incident command system.
Excellent. So you know how they say everything you need to know you learn in kindergarten? Well, I'd say this wisdom that you just heard are very, very helpful concepts, critical concepts that you would learn if you went to planning school. So if you got your master's in planning, you would know this, you would learn this, which I did, got my master's, so I gave that little plug there. And then I went to public health doctoral program. But what you heard in this I hope you're writing some of this down because it's really great information, was coordination is critical. Training is critical. Failure of systems, so that requires thoughtful thinking about how you ensure that system is in place. And you heard and got great examples of collaboration, whether it's collaboration with different sectors, disciplinary fields of veterinary medicine and others, or collaboration with the private sector or the military, for example, that have great examples. And I call this, so just what you heard today sums up what I think is critical to any sort of dealing with disease. So what's the mechanism? And I'll give you an example of what we use in the National Park Service. At least one example of one mechanism. So we formed what we call a disease outbreak investigation team mechanism. And where I work in the Office of Public Health, the National Park Service, we have 56 Commissioned Corps officers. I'm not a Navy. You thought I was Navy, I'm not Navy. I'm the United States Public Health Service. And in the Department of Interior, we have 56 officers assigned that do a whole variety of work, from occupational health to industrial hygiene to epidemiology to veterinary medicine to clinical medicine to environmental health to engineering. But what we formed was called Disease Outbreak Investigation Team, and that was when we have any sort of urgent issue. It could be exposure of bats where there's a possible rabies outbreak. It could actually be a raw sewage spill in one of our parks, and these are things that have happened. We form an interdisciplinary team of officers mainly, but not just officers. So we go out to others within the wildlife health branch or natural resources. We can more easily deploy our own officers because they have to go. They don't have a choice. But we certainly work very collaboratively with all disciplines within our agency. And this is just an agency example, so it's not even necessarily outside. But this do-it mechanism allows us to rapidly put together a team of, could be a mix of environmental health specialists, a medical officer, could be a veterinarian, to deal with a specific issue, someone who's really good at communications and outreach, someone who knows a lot about engineering if it's a facility that we're looking at. And even in that do-it mechanism, depending on the situation, I think you noted that, it really depends on the situation. Not every situation will be different. We may need to collaborate with the CDC or a local health department because it might be something that doesn't respect borders, the problem that we're having. So in terms of mechanisms, I think you have to, just as these gentlemen said with the vast experience they have, you have to plan, you have to prepare, you have to have it. You're never going to know what's going to hit you. There's no way you're going to know. Every situation is going to be different. But the better you plan and you think about all those things they talk about, the training, the coordination, the collaboration, the potential failure of systems to deal with that, you are going to be much more ready for whatever event that is. And sometimes, and we spoke about this before, sometimes you overplan. You have too many people. You have too many disciplines, and you say, you know what, I don't need to be here. That's okay. But at least we brought you in to hear and see if you should connect to this issue. Because the experts in those professional disciplines know, if they're really being honest with their discipline, whether or not they should be at the table. But it's better to have more people up front to ensure you have that aspect. And what's, I think, beautiful about an effective response is that we cannot do it alone. We need that interdisciplinary approach. We need, and so for me, planning is sort of this foundation of any field you go into. Any field you go into, you better be a darn good planner. So I'll stop there.
So what are some challenges to collaboration specifically that you can bring to the table, and how
Well, and just kind of, I think you're kind of hearing a repeated theme through here. During a crisis is never a time to act, right? It's got to be beforehand. And I think probably the biggest thing that I've noticed over time has been kind of a failure of the imagination to go to what could happen. I think there's you know, the rapid intensification of hurricanes, for example, has been some kind of a new thing that climatologists have been saying for a long time now. These are predictable outcomes, but I don't know that our leaders have really grasped the potential. 20 years from now, we might be talking about Category 6 hurricanes, Category 3 in the middle of West Virginia, dumping 30 inches of rain. I mean, the lack of imagination is I think probably our biggest flaw. And there's a psychological component to all this too. Most people don't want to go there. I know I talk to folks about, you know, some of my prepper work. I'm a bit of a hobbyist prepper, and you know, I've got my freeze-dried food and my camping, you know, water purifier and things like that. And people really genuinely think you're crazy when you start talking about this stuff. You say, no, it's not crazy. It's, you know, thinking of things to save my life in an event of a disaster is not a crazy thing. We all should be thinking that way. But I think there's a psychological barrier that a lot of people put up that they don't want to go there. And it doesn't mean that you wish it to happen. It doesn't mean that you know, that sometimes thinking of the outlandish might just happen. I mean, who would have thought 30 inches of rain in Houston with Harvey? Who would have thought, you know, a Cat 5 in Puerto Rico that would wipe out even the locals, people's ability to move FEMA resources around the island. I mean, that was part of the problem, right? The FEMA is a reach-back capability, really. It's supposed to be the local governance that is in charge, and they draw upon the federal government for resources. So FEMA shows up with, you know, arguably an inadequate amount of materials, but they did show up with a fair bit of material. I remember seeing an image of just a sort of a football field worth of pallets of water. People are drinking out of Superfund sites, and we have this football field of pallets of water. It couldn't get out to the people because the roads were so completely destroyed. They couldn't get the trucks through to get out to the outer towns and villages to be able to get the resources out there. So, like you said, you know, every disaster is different. You can't necessarily know everything that's going to happen. There's going to be new twists and turns, you know, through every disaster. But seeing, sort of imagining the completeness of the destruction from such a powerful hurricane and realizing that the roads were going to be problematic, start planning early in advance to get some dozers in there, something to clear the roads quickly so that you can get resources out. And just like you said, it is neglect. It is, neglect is a different word but that you use, but basically it's never the storm, it's usually the after effects. You disrupt the fabric of society, you disrupt electricity, you disrupt clean water, and that's what starts to lead to a lot of deaths. Another one was, I know that the USS Comfort showed up some 20 days later, or something on their order, don't quote me on that, but the USS Comfort is a Navy asset that has, I think, 700 or 800 beds or something like that.
900.
Several hundred beds. What is it?
900.
900 beds? Yeah, so a pretty phenomenal asset to have out there. People were dying because they couldn't get to their dialysis. They have that capability aboard the USS Comfort. They also have a nuclear power plant on the USS Comfort that can provide electricity. I think when you know, in the several weeks after the Hurricane Maria, there were on the order of about, you know, in the teens of numbers of people that ever sought comfort on the USS Comfort. And again, part of that is due to the destruction of the roads. People couldn't physically get to the ship. But again, a failure to imagine what the problems could be to try to work around.
Let me take a slightly different spin on this and move from natural disasters into infectious diseases, because the opportunity, I mean, infectious diseases are largely preventable. And the coordination challenge we have is not during an event. We've seen over the years increasing examples of governments coming together and communities coming together reasonably effectively in terms of how to respond to an infectious disease event, particularly those that are besotted with these things with a certain sort of annual periodicity. The response and the coordination can be reasonably good. But sort of picking up a point Ron was making earlier, these events, these outbreak or epidemic events, are the endpoint of events that we weren't paying attention to beforehand, that would have potentially prevented these events from occurring in the first place. And it's these upstream events, that's where you really want to bring sustained collaboration and coordination. That these are preventable. It's both in terms of the way we interact with the environment around us, how we interact with the ecosystems, how we interact with livestock, wildlife, the environment at large. And there's a way where all of these can work in better harmony, but if we don't have the right practices, you're going to end up getting the worst consequences. And the right practices are part of that need for preventive coordination, not just responding when there's a fire. It's about building the systems into the buildings that prevent the fire from happening in the first place. And that's where the coordination needs to be, and sustaining that is really challenging because people are always focused on the event right in front of them, that shiny little object, and they lose sight of those things that require sustainable, iterative engagement to make sure the worst things don't happen, and they're preventable not during the event, before the event. So the biggest challenge to collaboration, I would say, is being able to sustain ongoing multisectoral engagement, and sectors both in terms of whether it's ministries or private sector, communities, that there is a way that we need to be able to build into our cultural DNA, sort of a capacity for keeping our attention not just on preparing for the disaster, but preventing the worst consequences of the disaster. Going back to a natural disaster, the hurricane event down in the Gulf Coast just recently wiped out massive amounts of residential areas, but it's striking the number of residential areas that were totally unscathed, and it had to go back with the building codes and how they built those structures in the first place. And so, you know, you could have prevented the worst if, in fact, you built into the building codes the kinds of rigorous requirements that we know that will minimize the impact of these events in the first place. So it's paying attention not during an event exclusively, it's recognizing that's the end point of a whole series of things that we should have been paying attention. It's not just moving the surveillance upstream, as Ron was talking about, but it's making sure that if you're the way you impact on your ecosystem, that it minimizes the disruptive event for spillover zoonotic diseases, that the way you market animals minimizes the risk of zoonotic diseases or the issues around antibiotic resistance. These things are preventable, but they require coordination and collaboration, multisectoral, across the spectrum during peacetime. Let's go back to the military metaphor again, and bringing greater due attention to peacetime coordination, and not just say it's a point for activation during wartime.
I'm going to build on those, but in a slightly different direction. I'm going to say money. Money is an obstacle to collaboration. How many of you have had a foodborne disease outbreak in the last week? Raise your hands. You're welcome. The community says you're welcome. The reason you haven't had that is because there is a whole system in food production that has reduced your risk. Do you know how much recognition we get for that? None. How much money we get for that? Almost none. Unless it's, I think you said, in-your-face kind of event, there is no incentive to provide the necessary funding. So I once proposed something for a foot and mouth disease outbreak in the United States. I kept saying, let's just continue to reduce our budget until we have the first outbreak. Then we'll know how much money we really need, right? It was not until the United Kingdom had a major foot and mouth disease outbreak in 2001 did anybody think about the emergency program effort within USDA. I happened to be the director of our emergency programs at the time, and one of the statements I made was, had I known it was going to give us this much money, I would have infected them sooner. So this whole money thing is an issue against collaboration. The way our Congress provides funding is there are different committees that have different responsibilities that provide tranches of money for their area. Agriculture and health are not in the same committee. I went to our secretary's office and proposed that we put in a budget, not to the agriculture committee, but we put in a small budget to the Commerce Committee, which is where HHS gets their money, to propose things like, monitoring for influenza in swine and poultry. Because that's not done for the agricultural community. We got that handled with a vaccine generally. But we're monitoring pigs for influenza viruses so that we can protect human health. So the Human Health Committee should actually pay for that. Secretary's office told me that I was absolutely crazy, that the Agriculture Committee would never go for that they would stop our funding, and it was a whole big thing that we couldn't go to the appropriate committees to get the appropriate pieces of money to operate in a One Health approach. So it was that segmentation, not only of our policies, but of the way our funding is aligned. And then there were some who sort of had the mindset, and this is where Dennis's big thing about a transformational change as to how we get our money. There were some that said, well, wait a minute, Congress gave us that money to do that. They want us to do it. So we're going to go out and hire the expertise as opposed to go to a different department where that expertise already exists and begin to share resources. Thank goodness for Nancy Cox at CDC. She was the head of the influenza branch, who said, we need to know what's happening in the swine population for influenza viruses, because swine had an H3N2 influenza virus that just circulates naturally in people. Does anybody know what the 2009 pandemic influenza strain was? It was an H2N2. Does anybody remember what it was originally called? This is 2009, we were all there. What was it called at first?
Swine flu.
Swine flu. You know who got them to change that? The US Department of Agriculture. Because countries like Egypt started to kill their pigs because they didn't want swine flu. Other countries stopped accepting exports of pigs because pigs had swine flu. So there were many other repercussions in terms of funding. What did Nancy Cox do? Nancy took her tranche of money and said, I need to have surveillance of the US pig population. She gave USDA, through an interagency funds transfer, money to do that testing. So that what the US has now is at least a rudimentary surveillance program in animals for influenza before it makes that jump into people to see how it may change. There's still a challenge with that because there's something called the Anti-Deficiency there's something called the Economy Act. The Economy Act says that one federal department can't subsidize the budget of another federal department. So, when it came to this influenza testing, what CDC could pay for were the materials we used to run the test. We could not use that money to pay the salary of a technician who was running that test. So even though we had large numbers of samples and could have used an additional employee, we couldn't spend the money that way. I remember Dennis and I had a conversation a while back. Dennis and USAID was distributing personal protective equipment for influenza. There was a Rift Valley fever outbreak. Dennis wasn't able to give them equipment that was purchased with avian influenza money for Rift Valley fever. That was misappropriation of funds. So there's where some of the collaboration issues come in, is even though, when I said before, that personal communication stuff, even though that can happen, there are sometimes policies somewhere in the back that prevent you from doing these things. And that's where the transformational piece that Dennis is talking about is, you are the future leaders in this area. Think deeply about those complex problems and try to figure out well in advance what there may be that you need to overcome, so when the event occurs, you've already gotten those kinds of things lined up.
Yeah, that's great, Joe. And, you know, I'd say that while you said money's the challenge, I think it's lack of creativity, and the example you provided is a great example of being creative. Because it's not always money. I mean, it's not always just money. It's diverting resources, human resources. It's getting around that barrier, that challenge. So that was a great example. So challenges to effective response, collaboration. I think there are many that you may encounter on a whole variety of levels, depending on the situation you run into. But some of the things I've run into are a lack of creativity, or a lack of. You can have a lot of creative people, and then somebody at the top doesn't allow you.
I see your frustration.
So anyway, I think a challenge can be some individuals who are not comfortable working outside their comfort zone. When you have to be comfortable doing that, I think ego and sort of a territorial feeling of, this is my area, I'm the expert, and get out. When we really need to share with one another, we have to share data, we have to share information. I think that sometimes has to do with ego. I think a lack of listening and hearing. So if you're a very good listener, there's so much more you can accomplish if you really listen to what are the challenges that individual sees as going to inhibit us, and what do you think the challenge, and good discussion around that, good listening. So I think these are some of the things that you haven't heard today that you'll absolutely run into. And I think how do you manage those things? You step back, you take a breath, and you talk and you listen. So you're going to run in those kind of challenges. You can't help egos and territory, but there are also ways of being a leader where people feel empowered, that it's their idea, where it's they do own it, that you're not taking away ownership, it's theirs. And sometimes with people you have to deal with their ego. And because ultimately you want the result. You don't really care that, you've given them credit for something that maybe you deserve credit for. The important is you need them, and so you boost their ego, and then you get the result you need. And so you find it's dealing with different personalities and some of these issues. It can be challenging.
Could I add just a little thing about the ego piece?
And I'm not talking about you.
No. And I'm going to make it about something else. Here's the ego piece. Where did I learn One Health? Well, it seemed to be natural being a veterinarian. What I like to say, Ron, is that Ron, as an MD, specializes in one subspecies of primate. We specialize in everything else. But as part of that, my master's degrees is from the University of Minnesota. I was doing research in the College of Veterinary Medicine on a herpes virus of swine. And I was taking all of my classes in the School of Public Health. One short bus ride between Minneapolis and St. Paul to be able to do that. In fact, one of the things we were doing over at the College of Veterinary Medicine is using pseudorabies virus, this herpes virus of pigs, as a model for human herpes virus, and looking at what could recrudesce virus and what stress does and so on. But where I'm trying to bring that is that when when we try to work across those lines, it becomes very difficult. Al Franken, this is where the Minnesota piece comes in. Al Franken, senator from Minnesota, was very close to folks at the University of Minnesota. So I'm sure that's where the idea of a One Health Act came from, that he had introduced into Congress a One Health Act that pretty much said, let's all work together. Sing Kumbaya when we're done. So Al Franken is now out of office. Tina Smith comes in his place, and Tina Smith's staff still remembers this. Now, it's in the next Congress, but they produced a One Health Act. They called it a little bit different. It was something about using a One Health approach to response. They tried to make it a little sexier for people to say, oh, that sounds good. And much to Tina Smith's credit, do any of you know Bernadette Dunham? Yeah, okay, so Bernadette and I and Cheryl Stroud from the One Health Commission and a couple of other people got together and started thinking about this new introduction of a One Health Act. Well, coincidentally, what was happening was a reauthorization of the Pandemic and All Hazards Preparedness Act, the PAPA. It was the 5-year term for it to come up. We got together and said, you know what? Passing a single bill on One Health that nobody quite understands in Congress anyway, or this short-sighted thing, they weren't going to pass it. So what we did was we took the Pandemic and All Hazards Preparedness Act and added about 5 sentences that were the essence of the One Health Act. Tina Smith's office said, good, we're going to go with it. And she was able to get those 5 or 6 sentences into the Pandemic and All Hazards Preparedness Act, so that there is now, and they didn't use the word One Health because they didn't feel there was a good definition, but they used multisectoral collaboration. So now it is in an act of Congress saying that the secretaries of Interior, Health and Human Services, Agriculture, and so on would work together in this multi-collaboration way to prevent future pandemics. On the other side, the Farm Bill, which governs what agriculture does, was too contentious because there was pushes about what the SNAP program, Supplemental Nutrition Assistance Program, formerly called food stamps. There was too much contention in Congress about that piece of it that they wouldn't even listen to trying to get a similar 5 sentences into the Farm Bill. So it doesn't exist on the agriculture side, it does exist on the human health side, but at least it calls over. And there's the ego pieces. Fortunately, Tina Smith was willing to let go of the ego of introducing her own piece of legislation and was willing to get the concept across by putting it into the PAPA. But on the other hand, the egos around the SNAP program just destroyed, any of that collaboration from occurring. So sorry, just reminding you of those kinds of things.
So we're actually out of time for this panel, but thank you all so much for coming. Let's give them a few minutes. I wanted to open it up to the audience if anyone had any questions for either the panelists from the first panel or anyone sitting up front right now. Maybe just 1 or 2 questions if you want.
Don't be shy.
Dr. Newman, you mentioned on your response teams you have different professional fields coming together. So you have veterinarians and you have environmental health specialists. Can you just explain an example of how those different teams work together to overcome or respond to one of their emergencies?
Absolutely. So in a recent example, we had an exposure, one of the largest exposures of of bats in infestation in one of our facilities in one of our parks. So we brought together a team including medical, veterinary, environmental, and then integrated pest management, so biologists, who would all come together. So we actually deployed them, went to the park, were there for about a week, meeting with the superintendent. So the superintendent is the land manager. He or she manages that, has the responsibility to manage that park. And this is a big park, so some of these parks are pretty big. We have thousands and thousands, 10,000 visitors a year. And they did collaboration together in terms of looking at different aspects. One looked at the building itself. Where can bats intrude? So engineering actually was one. Where can bats intrude? How could we prevent bats from getting in? Why are they getting in? From a medical standpoint, we had our medical epidemiologist who works for me, and she was able to do a town hall with the veterinarian on what are the risks and dispel some of the, one of the things we do in the National Park Service is we take a One Health approach. Our responsibility, our mission is to protect the resource. So it's very easy for us to align with One Health. It's sort of a natural marriage. In fact, there's nothing in our mission that says anything about protecting people. It says protect, which is interesting as a public health practitioner when you work for a mission. It says nothing about protecting people, and that's what your job is. But the advantage we have is we can easily take a One Health approach because we have a responsibility to protect the environment, the wildlife, and the people, the resources. So there's this natural understanding of that concept that we can bring to any deployment or response we do. So in this case, bringing together an engineer, integrated pest management, a medical and a veterinarian is just sort of natural. They sit at the table, they talk to the superintendent, what are your concerns? Here's our approach. We're gonna actually do interviews. We're gonna conduct interviews with people who were in this cabin and find out what their symptoms are. Have they gone to the doctor? If they have certain symptoms, we're gonna recommend prophylactic. So we talk through the approach, and you've got this interdisciplinary team of folks who have a different role. One, again, looking at the facility. Another looking at sort of the diagram of communication. Another one looking at the human disease. And the other looking at animal. And as I said, we don't vilify the species. So even there's a caution in saying, our veterinarians don't like to say integrated pest management. They don't like to even use the word pest because we're protecting the critters. So you sometimes see a vilification of animals. Well, bats have an important role in the ecosystem. They make it. So in some public health worlds, it may be just, let's get rid of this invasive species. Well, yeah, you want to protect humans, but it's really how do we manage the wildlife that are critical to this ecosystem and actually contribute to our entire health. So I hope that helped answer the question. Okay.
If I could, I just wanted to make sure that everyone's understanding what you just said. Because I think it's more than having a medical epidemiologist and having a veterinarian and having this person and this skill and this, and you put them all together and you make a plan. I want the military metaphor again. Dwight, and this is what everybody was talking about and what I've gotten out of this panel. But Dwight Eisenhower said famously that the plan is nothing. Planning is everything. And it just doesn't matter what you come up with. The important thing is that process of having people exchanging their views, getting to understand each other, getting to know each other, because it's remarkable how frequently you come across the same people in the same kinds of settings. And people might be carrying around the guide with them, like the tripartite guide that you're working on, Joe. But it doesn't, nobody really consults the guide very often. If you have people who you know and who you trust and who you understand because you've worked with them to put these things together, that's who you rely on rather than on the written word, which was written by some medical epidemiologist or somebody who might maybe never left their office or their natural habitat. So I think it's really important for students and others especially to understand that, and I never really believed in this until relatively late in my career, but the networking part is really important. And the personal relationships that you form, even if they're not permanent, but in pursuit of a single objective, that's what's really important in making these things really come to life after the word goes on paper.
I'll say that in these do-it responses, disease outbreak investigation teams, oftentimes we do know each other, we know and having a mechanism, a plan in place where you're clear about the different roles and the responsibilities and
Absolutely.
who's the leader, absolutely right. But, sometimes you're in a situation where you don't know who's on the team. You don't know what their skill set, but as I said, I think that's where you do have a plan in place, you have a leader who you trust, who's had experience leading folks, and invites that person away, and that their contribution is valuable in building that team. But you're absolutely right. I mean, I think a key to all this is relationships. We're people. We're animals too. And we do effective work together when we care about each other. And so my number one task as a director of a program is to build relationships and to ensure that my staff care about each other and have an environment, working environment, where they feel cared about and they feel valued, no matter their profession, and that they bring an important contribution. So I think what you underscored is really, really critical.
While we've been talking about organizations a lot, I also want to point out, and this kind of goes to your last question here, is that I think that disaster preparedness and management is everybody's responsibility. I remember after Hurricane, not Maria, you lose track, right? Mexico Beach, Florida.
Andrew.
Michael. Right? In this crazy went through. They were interviewing a guy on CNN. It was like right after the hurricane, like within 24 hours. And he runs out and he goes, I can't wait for help to come. I'm out of food. And I'm thinking, that's a disaster preparedness is everyone's responsibility. I tell people, take yourself out of the equation. The less needy you are, the less you're going to need the very limited resources. And there's a lot of confusion. It's like the fog of war. It's in a disaster. The ability for people to get to you is probably going to be a week or two, depending on the type of disaster you're talking about. So personal planning, and also it's not just the organizations up here, the very talented folks up here that prepare and plan. It's all the way down to the building code folks, right? The city planners. There's a house, if you look up concrete home in Mexico Beach, Florida, there's one home, well, there's several others, but these guys built this home to withstand a 240 mile an hour hurricane. Code requires 120 mile an hour hurricane. And they were left standing, not a shingle missing on that house, because they planned for hurricane force wind windows. They literally put a cable all the way through the substructure, all the way through the roof, and then back down the other side of the substructure. So it was an incredible effort. And a lot of people think, well, you go from 120 to 240, that must mean you double the cost. Not really. It was stuff like smaller eaves. Don't put a big porch on the back end that could blow away. Stuff like that makes all the difference. So really I think preparedness starts out long before and is the responsibility of many people.
Thank you all so much for coming. Thank you so much to the panelists, everyone. And I hope everyone signed the registration sheets and put on their email so that I can send everyone PowerPoint slides that you saw today, biographies of these wonderful panelists, and get you connected to the Facebook page so you keep coming to these events. We will have events like this throughout the year, and we'll have speakers just like you heard today coming. So yeah, thank you everyone so much.
Congratulations to the One Health team here at GW. Well done.
Yes.
It's a local solution. Yeah, I might stop reading operating. Yeah,
Dennis put us on.
I'm going to the operating exhibit.
Good for you. All right. It's not that big. Do the whole thing. There's a bunch of interactive stuff.
Save the world. Out your
But read all those sounds. Take a picture. Huh? Take a picture of them? Of course it is. Dennis is in it. Thanks for coming, guys.
Yeah, I actually got it 2 weeks ago, so I'm proud of it.
No catch up, no catch up. I told you.
Yeah, you want,
Alright, so for our panelists, smile on 3. 1, 2, 3. There you go. And then the projector looks great in the background. Alright, one more. Perfect, thank you.
Good.
And then do we want a picture? If you don't mind, if we could take a picture with you all. Awesome, we're on the
Oh, which one?
Johnson.
John Snow, God bless him. I used to.
Oh,
Yeah.
join the John Snow Society.
Thank you.
I hope you want to.
You must have it there.
the two-eye national interagency.
Yes.
And then you adopt it as the.
Oh, if you wanted And so we have a vision with the Okay.